So good evening everyone. So I'll be discussing regarding this trial DESTINY-Lung03 part 1. So this is regarding T-DXd monotherapy in pre-treated HER2 overexpressing non-squamous NSCLC. So HER2 overexpression, that is IHC 3 plus or 2 plus, is identified as almost 3 to 20% of NSCLC tumors and are associated with poor prognosis. So T-DXd is approved in several regions in US and Europe with HER2 positive unresectable and metastatic NSCLC, and US for previously treated unresectable metastatic HER2 positive solid tumors with no alternative therapies. So the approval of this HER2 positive in HER2 positive solid tumors was from DESTINY-Lung01 cohort 1A result, in which the response rate of T-DXd was seen in almost 34% of patients, and in IHC 3 plus the response rate was almost 53%. So in DESTINY-Lung03, it was evaluating regarding the safety and efficacy of T-DXd based regimen in HER2 overexpressing, that is IHC 2 and IHC 3 plus NSCLC. So this is the study design. This is a phase 1B multicentric open label dose escalation study of T-DXd in HER2 overexpression NSCLC. So basically there are several parts. So I'll be discussing regarding this part 1, that is T-DXd monotherapy, and the enrollment of this arm is complete, and the key endpoint of this monotherapy arm is response rate, duration of response, disease control rate, PFS and overall survival, and safety and tolerability. So this is regarding patient dispositions. So 36 patients were enrolled, and 33% of the patient discontinued treatment either because of progression of disease or adverse event or patient decision. And the median duration of T-DXd treatment was 7.2 months, and duration of follow-up was around 15 months. So coming to regarding the demographics and clinical characteristics, the important point is that they have included patients with brain metastasis, which was seen in 30% of patients. And when we see the IHC status, so 2 plus patients were there in almost 55% of cases. Regarding PD-L1 status, they have stratified, and the PD-L1 less than 1% was seen in 33% of patients. And the prior therapies, those who received EGFR TKI in the prior therapies, were almost 52% of patients. So coming to outcome with T-DXd, the overall response rate was seen in 44.4% of patients, and the disease control rate at 12 weeks was 77.8%. So median duration of response was 11 months. So that is quite good. This is regarding PFS and OS. The median PFS was 8.2 months, and median OS was again 17.1 months. So again, as good data. This is regarding the best percentage change from baseline from the target lesion. So this is the waterfall plot. So when we see the stratification based on the PD-L1 status, so when PD-L1 is less than 1%, those patients did well with T-DXd, and the best percentage was magnificent in this group of patients. This is regarding the exploratory analysis of T-DXd response rate and PFS and OS in those patients who are IHC 2 and IHC 3 plus, and those patients who received prior EGFR TKI and no EGFR TKI. So those patients who are IHC 3 plus did better than in comparison to IHC 2 plus, and those who received EGFR TKI comparatively or numerically better in comparison to those who have not received EGFR TKI. But PFS and OS was almost similar in both population. Regarding safety summary, the most common adverse event was nausea, vomiting, fatigue, and the grade 3 and more side effect was mostly anemia and fatigue, and the drug related adverse event was seen in almost 94% of patients, while the grade 3 and above adverse event was seen in 40% of patients. The characteristic side effect, that is ILD, which is associated with T-DXd, was seen in 2 patients, and the drug related left ventricular dysfunction in 1 patient only. So to conclude, this DESTINY-Lung03 part 1 confirms the clinical benefit of T-DXd monotherapy with a dose of 5.4 milligram per kg body weight in a pre-treated HER2 positive, HER2 overexpressing IHC 2 plus or IHC 3 plus metastatic NSCLC. Building this DESTINY-Lung01 cohort 1A results, while the exploratory analysis showed that the HER2 3 plus or 2 plus NSCLC, or those who received or not received EGFR TKI did better. When we see the overall response rate in HER2 3 plus, it was 56% and PFS was 6.9 and OS of 16 months, while in 2 plus the response rate was 35%, PFS 8.2 and OS of 17 months. While those patients who received EGFR TKI, the response rate was 68%, PFS of 8.2 months, OS of 19.6 months, and those who not received EGFR TKI, the response rate was a bit lower, 17%, PFS of 7 months and OS of 14 months. So these data suggest that T-DXd associated with improved outcome over the second line standard of care in metastatic HER2 positive NSCLC, and there is no new safety signal were identified. And DESTINY-Lung03 is ongoing. The part 3 and 4 are assessing the T-DXd better regimen in patient naive, treatment naive HER2 positive metastatic NSCLC. So this was my last slide. Thank you so much.